Hello, I'm here with Bonnie Blanchly, and we are here to talk about physician's visits. Bonnie is a registered nurse, a death doula, and an educator that specializes in end of life. Welcome.
Thank you, Kathleen. It's great to be here.
Yeah, this is fun. We're both part of the Gentle Passage Doula Collective. And today we want to talk about who needs the services to go to a physician visit. Like, who are some of your typical people?
Well, physician visits are really important, and physicians have so little time, as it seems like, to spend with clients. So, my typical client, especially of late, has been people who have been diagnosed with a life-limiting or life-ending disease. But the tips that I'm going to give you today could be used for yourself. I mean, you could, use some of these ideas for yourself, but I use them a lot. And in fact, exclusively with all my clients that I work with that want me to attend to their physician to visit with them or prepare them to go.
Okay, great. So how about if we talk about preparing? What are some of the things that are important in preparation?
Well, when I first meet with a client, very often they've just gotten a diagnosis of cancer. And so they haven't heard anything else the doctor has said except that they have cancer.
Sure.
And so there's usually a week or so before they're going to go back to see the doctor again. And so that's the time that I often get called and they say, I've just got this diagnosis with cancer. I don't know what to do. I'm going to see my doctor next week or in 2 weeks. What should I do? And sometimes they say, can you go with me?
Yeah.
And so I always try to go with them if I can. And generally that's worked out pretty well for me. So as we sit down and think about what do we want to do to prepare for this visit, it's really thinking about what do you need to know or what do you know about your condition right now? And then let's figure out where we need to go with it. And so a couple things that I want to remind people about when you go to a physician visit. So like if you're just going for a physical exam, an annual physical exam, some things you're always going to want to have on your list is talk about your advance directives and whether or not you need to have a pulse. Not everybody needs to have a pulse, but most of my clients do because they have cancer,
Right.
and the chance that they could die within a year is pretty reasonable. So a lot of times what I do is I go over advanced directives with them and their pulse form before we even go to the doctor. We go through them step by step and they complete them, and then they're there for them to talk to their doctor about. So that's one of the really important things. And then I ask them to think about their immediate needs right now. What are your concerns right now? What kind of problems are you having right now? And so if it's been a couple weeks, I encourage them to start a list because you can be out just taking a walk and suddenly you're starting to have hip pain. And so if you start keeping a list of all the things that you're experiencing or things that are worrying you, you can just create this nice list that you can just take right into the doctor's visit with you. And so that really helps. And then if this is a second visit, which in fact, for most of my clients, it is the second visit,
Yeah.
I ask them to think about changes.
Yeah.
What's changed since you last went there? Are you having more pain, less pain? What relieves your pain? And be able to have conversations with them about that. So that's kind of how we get started.
Good. So setting a framework about what you want to have happen and what you want addressed and making sure that you don't forget it when you get in.
Right.
Yeah. Okay.
Yeah, and that's the purpose of the list because
Yeah.
so many times, you go to the doctor even just for a physical exam and you think, okay, I'm just going for a physical, but then you forgot about that pain in your hip that you have when you walk or your trouble sleeping at night and you want to talk about weight or something, but
Sure.
you forget because you didn't create a list. And sometimes the doctors have their own agenda that
Sure.
they want to get done, and so you don't get a chance.
Sure. Yeah. And a lot of these folks are specialists and they have a hard time getting in or reaching their doctor. So having that to
Yeah.
make to feel secure about it. Yeah. So you're making me think about going to the appointment now. and having a second set of eyes and ears being really valuable. How about if you tell us what would happen in the appointment and what would be helpful as far as having you there?
Sure. My goal always when I go to the appointment is to get my patient to advocate for themselves.
Mhm.
I try to prepare them to say, these are the questions that
Yeah.
you should answer and or ask. And do you agree with that? And they usually say yes. And so then in the appointment, I try to just sit there quietly. I take notes and I listen to what the doctor is saying and I take notes about what the doctor is saying. And then I also have a copy of their list. So if they do forget something or skip over something, then I will cue them and say, did you want to talk to the doctor about this? And usually they'll say, oh, yeah, I forgot about that. And then they'll have this dialogue. But I really try to step back and not be the person who's asking all the questions because it needs to be a conversation between the doctor and the patient. And so I'm really there just as that second set of ears to make sure that what they asked is what they wanted to ask and that they got all their questions asked. Yeah.
Yeah, and I really appreciate that because I know for people often is not feeling like you can advocate, that you don't ask, you don't double guess your doctor, you don't second, guess them, and that it might feel rude, or if a worry comes up, feeling like you're able to address that worry. Does that
Right.
seem like something that is
Yes.
important? Yeah.
Yeah. Worries are crucial. And I've had doctors really take a lot of time with people
Yeah.
when they're scared. And like I have a client now who she says, "This is my life. I need to make sure I'm doing the right thing." And so we had a lot of discussion about second opinions.
Yeah.
You know, how to get a second opinion, who to see for a second opinion, and that kind of thing. So lots of questions do come up, and then certainly I'll jump in when those come up because that's one of the reasons they have me there is because of my nursing background,
Yep.
and I'm used to dealing with doctors, and it makes it a lot easier for them. But it's important that they get all their questions answered. So
Yeah, and especially knowing grief and stress, like clarification and what my ears hear as the patient versus you could also be different. So being able to come back to you as far as
yeah.
what you hear. So the after the visit, what does that look like?
After the visit, I sit down with my client immediately after. We'll go get a cup of coffee in the hospital or a
Yeah.
Starbucks or something, and we just sit down and we talk about, okay, what happened in this visit, and what did you hear the doctor say?
Mhm.
And so I ask them to repeat what they've heard,
Mhm.
and then I take my notes out and I say, did you get this? So we go through every the single thing that the doctor covered in that visit. And then we talk about next steps, so what has to happen next? What doctor's appointments do you need to make? What happens if the office doesn't call you about the next appointment? I also make sure they get signed up on their e-care if they're a UW patient, or most of the hospitals have some sort of electronic medical record that they can access.
Mhm.
And I really encourage them to get hooked up with that. And some of my clients will they'll put me on that so that I can see their medical record too.
Yeah.
And that's really helpful as we prepare for the next visits that are coming. So I can look at labs and things, but I don't provide care as a doula, but as a nurse, I can look at labs and come up with maybe some different questions that somebody might want to ask. So, like if it shows their blood glucose is pretty high, then we might talk about how does that interface with their condition? Is it a medication causing it? Is it their diet that's causing it?
Uh,
All those kinds of things. And so I think some of the biggest things that people want me to look at, though, are the drugs, especially when they're starting on these drug regimens for cancer.
mhm.
What do they do, and what are the side effects? Even though the physicians' offices are really good now about giving people all the information about their drugs so they can see what the side effects are. They don't always go into detail with them. And so this chance for me to say, okay, here's what this might look like for you.
Yeah, yeah, really
So,
valuable. So
yeah,
Bonnie, one thing I'm thinking of when listening is if someone couldn't, like if I couldn't be there with my mom at a doctor's appointment, or if, someone lives out of town, and especially now with the circumstances the way that they are, families being split, um,
yeah,
that it would be that would be a perfect client potentially.
right. Yeah, they would be great clients to have. I've even set in online too, so like
Mhm.
if because we've had such limitations
Yep.
sometimes with COVID. And so like I had a gentleman and his wife went to the appointments with him and they can only have one other person go. So I would get on the phone while they were in the doctor's office and listen in, and then I can cue them that way too. So sometimes we have to be really creative in how we do this,
Yeah.
especially during this time. And that's really important. I've also had it where the spouse said, "Hey, you know more than I do, so you go with my spouse, and then I'll catch up with you after." And I've done that as well, but that takes a lot of trust on the part of the client, to know
Yeah.
that you're gonna do that. So, but that's part of it,
Yeah, and sometimes the stress of the other person being there can also play into how forthcoming the person can be, especially with a diagnosis that is so serious, about being
Yeah,
able to be honest. So having somebody who is more neutral there could be a
right.
huge benefit.
Yeah, because there are times when, spouses can be a hindrance in a way
Sure.
because, that you don't wanna say anything that is gonna make them feel worse. So, but
Exactly.
you don't get your questions answered because of that. So,
Hmm.
I ask people to really think about that, and what makes sense for them.
Yeah. Yeah. Is there anything else that feels important to consider or you'd like people to know about this service?
Um, I think just to consider it, especially for your, if it's for a parent
Yeah.
or a loved one and
Mhm.
you can't be there.
Yeah.
I mean, I think it's very valuable. I've heard lots of people say, "Oh, I never thought of that."
Yeah.
So it can be a really valuable thing, I think, for people to consider. I know a lot of times people think going to the doctor's no big deal, but most people have some anxiety over it before they go. And so just having a second set of ears is great. And I think especially now in this time when healthcare workers are feeling overwhelmed by this pandemic, yet now, we're allowing physician visits and other kinds of surgeries to
Mhm.
happen. So,
Mhm.
um, but I do find the doctors are very receptive to it. They like knowing that a person has an advocate kind of
Yeah,
person with them because lots of things can slip through the cracks,
you bet.
and we don't want that to happen. So I think there's a real value in the service for doing it. Yeah.
I do too. I think simplifying, clarifying, and then having a clear sense of what happens after, and then being able to communicate that
Yeah.
is really valuable.
Yeah, and just one of the other things that I do after it's sort of like after the after visit
Yeah.
is, I usually check back with my clients in a week or two to see how they're doing if they have another visit coming up. And it's not that I have to go to every single visit, it's whatever they're most comfortable with.
Sure.
But sometimes I have clients that are just going in for treatment, so they don't feel like I need to be there. But if they're going to see the doctor as well as have a treatment, then I usually go for the doctor visit,
Yeah.
but not necessarily stay for the treatment, depending on how they're feeling and how they're doing.
Sure.
You
Sure.
know, it's really tough when you get bad news, and then if you find out your treatment's not working very well, it's good to have some moral support.
Yep.
So I often also have them, bring a friend. If a friend can come and sit with them, somebody who can, talk to them and get their mind off of what they're doing while they're sitting in a chair getting a infusion therapy or whatever. Just having a good friend there sometimes can really be more helpful than me being there.
Absolutely. Yeah. I also think that really having clarity about how bad a situation is or how something's changing or progressing so that the family I know that for
Mhm.
me in our family situations where we've lost people, that progression isn't always really clear. So having some clarity on that about what you hear at the doctor's office and how serious it is,
Right.
can also be really, really helpful.
Yeah, it can be. And, some people want to know how much time they have left and others don't.
Yeah,
But I usually remind them that doctors are terrible about predicting when you're going to
they
die,
are.
except when you're almost dead.
Sure.
But um, but for the most part, people just want the truth.
Yep.
They want to know what's going on with them. They want to be able to be well informed so that they can make good decisions about their health care.
Yeah.
And that's what my goal is for them. Is
Yep.
make sure they have all the tools and knowledge they need to make good decisions for themselves.
Yeah. It's a big part of our philosophy with the Gentle Passage Doula Collective is that dignity, making sure that you have as many choices and can make those choices based
Right.
on the
And
information.
yeah, and from out of that can come more support as they
Yeah.
go down the trajectory towards end of life, whether, we can really clarify what kind of end of life services they want at
Right.
the end. And they can do funeral planning and legacy work. There's all kinds of stuff that people need to pay attention to. And if you plan well, you'll die well.
Yeah. Yeah. Thank you. How can people get a hold of you, Bonnie? What's the easiest way?
They can either call me directly. My cell phone number is 206-817-2549, or they can email me. And my email address is blbnurseconsultant@gmail.com.
Okay, great. So I'll be sure and we can put that in the text with the film, with the video as
Okay.
well. And thanks so much. I'm
Yeah,
so glad.
thanks for having me. It's been fun.
All right. I'm sure we'll hear from you again. So many
Okay,
services that you offer.
sure.
Thanks, Bonnie.
Thanks a lot.